Hi, my name is Kaylee Zapata, and this is my didactic video in my assessment of Emmanuel. Emmanuel is a 27-year-old male who I will be assessing today. We're going to start with the head, upper and lower extremities, skin, and scalp. So the first thing I'm going to do is I'm going to inspect the upper and lower extremities. I'm just going to inspect the color of the arms, and the color is appropriate to skin tone. Legs out in front of you, please. And the color is appropriate bilaterally on the lower legs. The next thing I'm going to do is inspect for any lesions or lacerations on any part of the arm. I don't see any on the inner aspect or the outer aspect bilaterally on the upper arms. And the lower legs seem to be clear of any lesions. Just leave your legs. Of any lesions as well. Male hair distribution is even throughout according to male hair distribution. Texture appears to be soft. There are no masses palpable. There are no lesions palpable. There's nothing noted abnormally. Turgor, I'm going to check turgor. Put your hands out in front of you like this. Okay. Turgor is brisk, so hydration status seems to be well. The next thing I'm going to do, be doing is moving on to the head. The head appears to be round and symmetrical. The scalp appears to be well nourished and not dry. It looks moisturized. It appears to be coarse according to ethnicity. The scalp seems to be even, palpating for any masses at all on the scalp. No masses noted. And the facial hair seems to be growing inappropriately. There is no folliculitis. There's no issues with that. The next thing I'm going to do is grab my thing. With your, nails, I'm going to have your hands out in front of you. And I'm going to just inspect the nail beds, and the nail beds seem to be appropriate. Place your fingers together like this. And there doesn't appear to be any clubbing. Put your hands back out in front of you. Thank you. And I'm checking capillary refill, and I would do this bilaterally. Capillary refill is brisk, proving that circulation is great and is flowing well. The next thing I'm going to do is get my tools. The next thing I'm going to do is test the trigeminal nerve. So I'm going to have you close your eyes, and this is soft, and this is hard. So I want you to tell me the difference when you feel this.
Soft left cheek. Do it again. Hard forehead. Soft nose.
Okay, trigeminal nerve is intact. The next thing I'm going to be doing is checking for TMJ. So I'm just going to slide forward a little bit. Okay, and I'll have you open up your mouth. And I'm just assessing, palpating on this muscular jaw. And I'm feeling for any nodules or clicks when you close your mouth. Close your mouth. Alright, good. And now move your jaw from side to side. Good. And push it out against resistance. Good. Perfect. And there is no clicking or crepitus palpated while assessing TMJ. The next thing I'm going to check is your mouth exercises. And for your mouth exercises, I'm going to have you smile and show your teeth. And then smile without showing your teeth. And close your eyes and raise your eyebrows. Okay, and then squint your eyes, close tight. And try not to open up. Okay, good. Perfect. And the next thing we're going to be checking. The next thing we're going to be assessing is the eyes, and the first thing I'm going to discuss with my patient is the Snellen chart, which is when the patient stands 20 feet away from a letter chart, and this tests their far-sighted vision and their ability to see things from far away. The next thing is Rosenbaum's test, which is the nearsightedness when the sheet is held 14 inches from their face, and that's a series of numbers that they can read correctly. And the final test we're going to do here is the confrontation test. And what I'm going to have you do for that is I want you to cover one of your eyes, whichever one you want. Alright, and then you're going to see this little bunny. And I want you to tell me when you see the bunny, okay?
Okay. See it. See it. See it.
Okay, and one more time.
See it.
Okay, perfect. And I'm going to assess that bilaterally. The next thing I'm going to do is assess cranial nerves 3, 4, and 6. And I'm also going to check for the 6th position cardinal gaze. So I want you to follow this pen light, just with your eyes, right? Okay. Good, really good. Okay, and the next thing I'm going to assess is perla. So I'm going to have you look straight at the tip of my nose. Good. Pupils are equal and round and reactive and 3 millimeters in shape. And now I want you to follow this pen light. Alright. Perfect. The next thing I'm going to do is assess the eyebrows and eyelashes. And the eyebrows appear to be thick and full, and the eyelashes as well. There are no lesions or exudate from either eyes. The conjunctiva, open your eyes. The conjunctiva appears to be pink. The sclera is white. There are no lesions or hemorrhages noted. The eyes appear to be normal in color, brown, and with no lesions or abnormalities apparent. I'm now going to palpate the lacrimal ducts. Okay. Any pain when I touch in here?
No.
Any pain up here?
Nope.
Okay, perfect. And the next thing I'm going to move on to check. The next thing that I'm going to be assessing is the ears. And for the ears, I'm going to be inspecting the meatus, the lobes, and the cartilage. There does appear to be some fattened tissues. The cartilage has been disrupted and it's hardened in some areas. The meatus appears to be... Did you just do something?
Mm-hmm.
The meatus appears to be appropriate in size. There is no drainage coming from the ears. Any pain when I palpate?
Nope.
Any pain over here?
Nope.
Okay, perfect. And we could also do a hearing test at this time. You could also use a fork, tuning fork. I was looking for the word. So for the tuning fork, I do not have one, so I will not be assessing that. The next thing I'm going to do is move on to the nose. And the nose appears to be appropriate in size and slightly deviated to the left. There is a small scar noted, 2 centimeters from a previous laceration that was there. The scar does appear well aligned and symmetrical. I'm going to cover one of your nostrils and I want you to breathe in. Good. Any problems with that?
Nope.
And the other side? And that is assessing the patency of the nostrils. The next thing I'm going to do is I'm going to have you close your eyes. And I would like you to keep your eyes closed. And I want you to tell me if you smell anything.
Yep.
And what do you smell?
I got cinnamon.
Yes, that is correct. That was a cinnamon air freshener. Go ahead and open up your eyes for me. Perfect. So the nostrils appear to be patent bilaterally. The olfactory cranial nerve 1 seems to be intact. He was able to appropriately identify the object that was placed in front of him. The next thing I'm going to be moving on to is the mouth. Please open your mouth for me. And I want you to lift your tongue. Yes, okay. And I see that the frenulum is intact. And there is teeth present with a few cavities. Open, tilt your head back a little bit. Perfect. And the palate appears to be pink in color and moistened. And I want you to stick your tongue out in front of you. Out. And the hypoglossal nerve is also intact and moves freely. And can you swallow for me?
Yep.
Swallow. Perfect. And he doesn't appear to have any difficulty swallowing. And the gag reflex would be assessed at this time. And the gag reflex is intact. So the next thing I'm going to be moving on is the neck. And I'm going to palpate the neck. Any pain at all when I'm touching in the back?
Nope.
And when I'm touching in the front?
Nope.
Push your shoulders up against my hand. Good. And relax. Perfect. And at this time I'm just going to palpate for any nodes. Good. The lymph nodes appear to be smooth, no nodules, no swelling, and no abnormalities noted. At this time I'm going to palpate the thyroid. Okay. There's no nodules noted there. At this time I'm going to auscultate the thyroid. Perfect. The next thing I'm going to do is check the carotid artery. Okay, and that's palpable bilaterally. And I would auscultate that artery as well. Okay, perfect. And did you have any tenderness at all when I was palpating along the neck?
Nope.
And I don't know any nodules at all. Great. The next thing I'm going to do is listen to your lungs. So, we'll move on to your lungs. I'm going to inspect and palpate the anterior and posterior chest for any masses or nodules. Any pain at all when I'm pressing in these areas?
Nope.
Okay. And any shortness of breath lately or anything like that?
Nope.
Okay, perfect. So the next thing I'm going to do is have you lean forward. And I'm going to place my hand in a certain amount of patterns. And every time I move my hands, if you could please say the words 99.
89, 99, 99, 99, 99.
Perfect. Okay, you can lean back for me. And there was vibration palpated equal on older aspects of both hands. The next thing I'm going to do is listen for your lung sounds. And for, can I also have you take off your shirt? I just need to inspect that area. And I'm inspecting the anterior and posterior chest for the color. Male hair pattern seems to be appropriate to his body type. This distribution is appropriate in a male, so that's fine. The color is symmetrical anterior and posterior. There are no lesions, masses, or nodules noted to the anterior or posterior part of the chest. Perfect, thank you. And I'm now going to take a listen to the lung sounds. Let me have you turn sideways and lean forward just a little bit. Perfect. Deep breath. Good. Yeah. Okay, lean back for me. I'm going to turn you around. And put your hands on top of your head for me. Perfect. Breathe normal. Deep breath. Perfect. Deep breath. Good. You can breathe normal, please.
Oh.
Okay. Go put your hands down by your side. Okay. Perfect. And the lung sounds appear to be clear in all lobes. No wheezing or diminished lung sounds were auscultated. The next thing I'm going to be doing is moving on to your heart. And for your heart, I am going to palpate the point of maximal input. There are no murmurs or skip beats palpated this time. I'm now going to listen to lung sounds. I'm going to listen to aortic, pulmonic, Erb's point, tricuspid, and the mitral valve, which is also known as the apical. heart sounds were good and normal in all bases, we are going to assess the peripheral pulses. So if you could just lay your hands out in front of you. So I'm going to check the brachial pulse. And the radial pulse. And I would check this bilaterally. Popliteal. Behind the knee. Posterior tibial. And dorsalis pedis. Okay, good. The next thing I'm going to do is have you lay down on the futon. Perfect. Okay, and hold the abdomen. And the next thing we're going to check is the abdomen. We're going to inspect it for any striae, vascular patterns, or abnormal hair distribution, which it appears to be smooth and normal in color. Male hair distribution is appropriate. The umbilicus is round and appears to be free of any striae or lesions. The next thing I'm going to do is palpate. And I'm palpating any pain at all when I'm pressing in there. Okay, perfect, perfect, perfect. And the next thing I'm going to be doing is percussing the abdomen. And when I'm percussing the abdomen, I'm going to be checking, I'm going to be listening for bowel sounds, any friction rub over the organs or arteries. And I'm going to listen to the iliac, renal, and femoral arteries. And then moving on to percussion. So I'm going to okay, and bowel sounds are active in all quadrants. I'm going to assess the iliac arteries. Renal arteries. And then we would assess the femoral arteries as well. And we would check it on the other side. The next thing I'm going to do is percuss the abdomen. And the next thing I'm going to do is palpate the liver. So take a deep breath in for me. And breathe out. Okay, great. And the liver does appear to be smooth. There are no nodules present. Any pain at all when I was pressing there?
No.
I'm also going to palpate the kidneys. So just, yeah, perfect. And lean against my hand. Okay, deep breath in. Any pain at all?
No.
The kidneys are palpable, freely palpable. Do the same thing on the other side. Deep breath in and out. Perfect, perfect. And this time, if you could assess the spleen, you would. And the spleen should be neatly tucked at the left upper ribs, under there. The next thing we're going to be checking is for the spleen, like I just covered. You cannot palpate it, so we can percuss over that area. The spleen should not be enlarged. Okay, all right. There we go, percussing the spleen. Okay. Okay, so moving on from there, we're going to do our musculoskeletal exam. And I'm going to go ahead and have you stand up. Sorry. Go ahead and just stand up. Perfect.
Stand up. Stay standing.
Yeah. And you can put your shirt on too. So for the musculoskeletal portion, we're just making sure that all the joints are in a good range of motion and that there's no issues or concerns with that. So we're going to inspect and palpate all the joints. Any pain at all, let me know. And his body appears to be well nourished and in good working condition. The first thing we're going to do is the neck. So I'm going to have you put your head forward and back. And way back. Yes, okay. So this is extension, this is flexion, and this is hyperextension. Or flexion, extension, hyperextension. And I'm going to have you turn your head from side to side. Good. Alright. And then I'm going to have you do it against resistance. So down. Perfect. And against my hand. Perfect. Okay. Perfect. And the next thing I'm going to have you do is roundabout. Okay, and for your shoulders, I'm going to have you raise your shoulders. Okay. Sorry, raise your shoulders. And then I have you do it against resistance. Great. Alright, and put your arms up like you're going to dive. And down. And behind you. And put your arms out inside. And try to pull. Okay. Alright, and push down. Good. Good. Alright, and make your... Okay. Okay, and the other side. Okay. And next we're going to be moving on to your elbows. So I want you to bend your elbows. And okay, perfect. And then turn your arms over like this. Supination and pronation. Supination, pronation. Perfect. Put them on your legs. And as fast as you can, turn over. Perfect. Perfect. And back up. And back up in front of you. Okay. So I want you to flex and extend. Okay. And then put your hands out like this. Perfect. And close them on my hands. Alright, good. And then I want you to squeeze both my fingers. Good. And push down. And press up. Turn your hands up.
Oh.
Okay. Alright, perfect. And then I want you to put your fingers. Okay. Good, 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 good. Alright. And the next thing we're going to do is move on to your legs. So put your legs...
Face it down. Face it down. There you go.
Put your leg out in front of you.
Mm-hmm.
And then down straight. And then behind you. And we would assess that bilaterally. And go ahead and bring your knee up to your waist. Good. And I'll have you go ahead and lie down on the futon. Okay.
You want me to hold it?
No, I'll hold it like this. Is it in there?
You want my whole leg? Face
Yeah.
it a little more that way.
Alright, so I'm going to have you raise your leg up. Actually, I'm going to have to...
Here, I'll hold it and face this way.
Okay.
That?
Yeah, perfect.
Like that?
Okay, yeah. Okay, perfect. Alright, raise your leg up. Alright, and down. Great, and do it against resistance. Perfect, and down. Good. And then again, bring your leg up to... Alright, perfect. And then for your ankles, I want you to rotate your leg inward.
Inward.
Perfect. And then outward.
Outward.
Okay, and then I want you to roll your ankle completely around. Alright, good, good, good. And I want you to pull your foot back, and then point down. Good, okay, perfect. And we would again assess this bilaterally. And then you can go ahead and stand up. Okay, and have a seat for me. And sorry, I'm gonna check the thorax, so I'm gonna have you stand up.
Oh.
And bend over and touch your toes if you can. Alright, and I'm looking at this side. Good. And the spine appears to be well aligned and symmetrical. Go ahead and stand up slowly for me. Good. Any pain at all during that?
No.
Perfect. Alright, so then we're going to be moving on. The next thing we're going to check is the heel to toe gait. Is it seeing you?
Yeah. What do you mean? Like that,
So,
right?
yeah. So we're just going to do the heel to toe, heel to
Okay.
toe.
I'm gonna walk towards you.
Okay. Perfect. Perfect. Okay, and turn around and go back to the same position. And I want you to close your eyes. Put your arms out in front of you. Out to your side, sorry. Okay. And Romberg's test was assessed. Okay, you can open up your eyes. A slight swaying, which is normal. The next thing we're going to do is the finger to nose test. So I want you to put your arms out by your side. And then you're going to bring your finger and touch your nose. And the opposite arm. Okay, and I want you to close your eyes and do that. Perfect. Good. One more time. The other side. Perfect, and that's good. And the next thing we're going to check is for the sensory reflex. So you can sit down if you want to. So I want you to tell me if you feel dull or if you feel sharp or soft.
Okay.
Okay, and where you feel it at. We're going to do this on your extremities.
Alright, okay. Soft right up arm. Hard left arm.
Okay, this way.
Soft right shin. Hard right foot. Soft left shin. Soft right foot.
Okay, keep your eyes closed and you put out your hand. I'm going to place something in your hand and I want you to tell me what you think that is.
Coin.
Yes, that is a coin. Perfect. You can open up your eyes now. Alright, come back. Alright. The next thing we're going to check is your deep tendon reflexes. So I'm going to use my percussion hammer. And hold your arm out just to the side, like this. Just let it hang there.
Okay.
Okay. Okay. And your patellar reflex, you have to let your legs
No.
kind of on the magnet again.
Hold on, let me grab it. Because you can't see it. Go ahead. Good.
Okay. And then I need you to turn around and face the futon. Let your legs hang over the sides.
Oh.
Alright, perfect. Thank you. And that is it for my didactic exam. Thank you.